Hello, welcome to my YouTube channel. My name is Megan Klee, and this video is an update on my experience of receiving cervical prolotherapy, which is a form of regenerative medicine on my neck. So if you haven't been here before, my YouTube channel is entirely dedicated to sharing tips and tricks and resources that I have found beneficial to finding relief from chronic medical conditions I've had, and just treatments that have been beneficial for me and have, I'm not sure if they've entirely saved my life, but have changed my life, and that have been really difficult to find because they are considered more experimental and are not offered in traditional medicine. And so that is why I have made this YouTube channel, because if I never got the treatment that I got, specifically what I'm talking about today, the prolotherapy on my neck, I would have suffered unnecessarily, probably for the rest of my life. And so that is what this video is about. All right, so another little, I'm going to reel it back a bit, brief backstory. I was diagnosed with Craniocervical Instability as well as Atlantoaxial Instability, which is the movement of vertebrae in your neck and in my neck, because that's what I have. And basically it's the abnormal movement, and it has cut off blood flow. It's compressed nerves in my neck. It's compressed all kinds of things. It's impeded my cerebral spinal fluid flow, and it has just wreaked havoc on my autonomic nervous system. It also gave me the secondary condition of POTS, which stands for postural orthostatic tachycardia syndrome, if you're not familiar, because it is not well known. And basically, those diagnoses wreaked havoc on my body and my life, and I was considered, could have very well been considered disabled. I had a very low functioning life, and I was rapidly getting worse with my conditions, but diagnoses were very difficult to come by. And so, because the criterion and all sorts of things that I've talked about in other videos, so if you want to watch those, you're welcome to. I'm not going to reiterate what I already said. But basically, all that to say, prolotherapy has changed my life. If you get nothing else from this video and you think that you might have similar problems, I'm not sure if it saved my life. I definitely thought at times that I was dying and had symptoms where it seemed like I was going to die. But I know that at the very least it saved my quality of life. And if not, I would have been very disabled for the rest of my life. So that's why I made this YouTube channel, because I was, in my opinion, unnecessarily suffering. And most doctors could not help me, and I know that a lot of other people are unnecessarily suffering as well. So if this helps just one person, it is more than worth it to me. All right, so all that being said, okay, so this is an update on prolotherapy. I got my last round, or my 6th round of prolotherapy at the end of May. So it's been about 2 months now. I got new neck imaging done recently. I have left shifting of my vertebrae. I originally had about 8 millimeters of slippage at the craniocervical junction, so my C1 on C2. And since treatment, it has decreased to about 3 or 4 millimeters. It's not completely normal yet, and so I am, in the next several months, will get a couple more rounds of treatment, and am very hopeful that my instability will be entirely gone within this next year. And yeah, so I will no longer have craniocervical instability and atlantoaxial instability, and so, which is really exciting. Okay, so next I just want to share my symptoms that have improved because my quality of life has greatly increased. So if you're considering prolotherapy or anything of that nature, regenerative medicine, and are wondering if your symptoms are associated with cervical instability and will improve with regenerative medicine, this might be for you. All right, so first and foremost, I had a lot of neurological symptoms prior to treating my prolotherapy. Most traditional doctors didn't know why I was having all of these neurological symptoms. Some suggested I might have multiple sclerosis or a degenerative neurological condition. Basically, traditional medicine did not have diagnoses for or diagnostic criteria for craniocervical instability and atlantoaxial instability in the way that it impacted my life. And so they didn't know why I was having these neurological symptoms, but it is attributed to the instability. Okay, sorry for all of that verbose, but I no longer have the things that I'm about to list. Prior to treatment, I used to try to speak sometimes and words wouldn't come out. Only unintelligible noises would come out on occasion. I would basically be speaking gibberish. This wouldn't happen all the time, but on and off. Prior to treatment, I would also write sometimes, and I would go back and read what I wrote, and I would rewrite the same word over and over again, but I didn't know that I had done that. I had lost a short-term and long-term memory for about a year. Things would happen that I just forgot, and the short-term memory loss was more common. I went to the emergency room a couple times and doctors would ask me about things that just happened and I wouldn't remember them. For example, I have all kinds of examples, but that's just a vague one. But that has improved. I don't experience memory loss anymore that I know of. I sometimes, in flares of symptoms, prior to treatment, all of this is prior to treatment, I'm just trying to be clear. I would think one thing, but then I would say another thing. My mind would just go blank a lot of the time, and I would be in what I describe as a catatonic state. People would talk to me, and I'd be looking at them right in the eyes, and I just wouldn't respond because my mind would be blank, and I wouldn't process what was going on well. Sometimes I would see basic words and I wouldn't be able to, I wouldn't know the meaning of the words or articulate what the meaning was. That started to happen to me when I was in college, and I medically withdrew from college when all of that started to happen. In flares of symptoms, I would be driving and I wouldn't remember where I was. Sometimes the last time I drove actually, I was driving somewhere I had driven hundreds of times and I just had no idea what turns to take. It was like my mind had just forgotten, and that would happen. I would slur my words a lot of the time, and it seemed like I was intoxicated. People would tell me that, but I wasn't. Sometimes in flares of symptoms, I would say one word multiple times in my head before being able to speak it out. I'm not sure why that would happen, but it would. Or I would start to say a word and I wouldn't be able to finish the word in my speech. So those are just kind of some of my neurological symptoms that I have not experienced since prolotherapy, which is a huge relief and amazing and insane in the best way possible. And crazy to me that all of that I've recovered from and healed from essentially, and traditional medicine wasn't able to help me and tried to diagnose me with other things. And so that, I would say, is my biggest improvement. Since getting prolotherapy, I haven't had to use a wheelchair, so basically in flares of symptoms, my legs would just give out on occasion, and I would crumble to the ground, or my muscles in my body would be so weak I wouldn't be able to walk, and so I would use a wheelchair. Since prolotherapy, my sleep has gotten much better. I had pretty bad insomnia. And when I started to wear the neck brace, that's when my sleep first started to improve. But it's greatly improved since prolotherapy. I used to get really like painful muscle spasms on occasion. I'd get tremors like in my hands and in my fingers. Sometimes for hours. This didn't happen to me as much, but I would get convulsions sometimes. I'd wake up in the middle of the night and my body would convulse a couple times. I assume that these were dysautonomic reactions, or I know some people with instability get dystonias or dysautonomic storms, which basically look like seizures or just tremors and convulsions and such. I had those at times, but they were not as severe as some people get. I didn't have full-on seizures, but all of that being said, all the spasms, tremors, and occasional convulsions have gone away entirely. I used to wake up sometimes with partial like paralysis, and the spasms and intense muscle pain. That's all gone away. I had really bad joint pain, mostly in my fingers. I would try to type and I would just have really bad joint pain. I had really bad hip joint pain. It would come and go, it fluctuated, but sometimes I'd have joint pain all over my body and muscle pain, and that's gone away. Prior to prolotherapy as well, sometimes I would stop breathing. I'd have difficulty breathing. I'd shallow breath, pressure in my throat. During these types of episodes, I sometimes thought that I was actually dying. At nighttime, I would wear an oxygen monitor because usually during these types of episodes, my oxygen saturation would drop as well, and so I had an oxygen monitor that would buzz me awake. I did a video on that. But since prolotherapy, all of that has gone away, which is a huge relief. And so that's why I said at the beginning of the video, I'm not sure if prolotherapy saved my life. It may have. I don't know if this would have eventually killed me, but it definitely saved my quality of life and saved me from disability, because I would have never been able to hold a job. I would have never been able to finish college, take care of myself fully, and so much more. And so that's mainly why I said that in the beginning. Okay, next thing. This kind of goes along with POTS. So my POTS has greatly improved. So if you have POTS, it might be secondary to cervical instability. But with the POTS, I used to have extreme temperature fluctuations randomly, to the point where my whole body would aggressively shiver for hours and I would be freezing. And the only way I would be able to function would be under a heated blanket, but I would still be miserable. And then it would go in the opposite direction and I would break out in full-on sweats a lot of the time, just because my dysautonomic nervous system was so disrupted. But that has improved a lot since prolotherapy, and I'm hopeful that once my instability is completely gone, that might be gone completely as well. Okay, so another thing, I would experience so much weakness in my body and fatigue that I wouldn't be able to move. And I would just slump to the ground and be in a catatonic state. But also, like, that catatonic state, I'm sure it was attributed to the neurological symptoms as well. But altogether, I have basically, it was from my cervical instability. Hold on. Sorry, it was from my cervical instability, which I no longer have. Sorry, I have a cold. All right, so I'm gonna go through some of my other symptoms that are on another page. Okay, so some other symptoms that have improved as well. My visual disturbances. So I would get triple vision, double vision. My vision would be blurry. I experienced a whole host of visual disturbances, and those have all gone away since prolotherapy. I talked about temperature fluctuations, but I would get really cold extremities. So my feet and my hands would be like ice blocks, but the rest, like my abdomen and the rest of my body would be normal temperature. That has not, that's improved. It's not entirely gone away yet. Okay, so I also, with the dysautonomia and temperature fluctuation, would excessively sweat a lot of the time. This would normally be when I was experiencing like pre-syncope. So if you don't know, syncope is passing out, which is a part of POTS. I rarely passed out, but I would experience a lot of symptoms that I would experience right before I passed out. And so I would just lay down and prevent passing out, but it still experienced a lot of those pre-symptoms, which usually was the sweating, and that has gone down. I experienced a lot of dizziness and lightheadedness. That's greatly improved. Sorry. I talked about my sleep. Brain fog has improved. It's not entirely gone though. I still have some brain fog. Okay, this was debilitating. I had excruciating sensory sensitivity to noise and light. It fluctuated, but I spent a lot of time in isolation because noise was excruciating, light was excruciating. I could not process stimulation, and that has almost entirely gone away, which is a huge relief. I've done videos on stimulation if you want to understand more of what I was experiencing prior to prolotherapy. I kind of mentioned this, I'd wake up and I'd be experience short-term paralysis for little bits of time. But in the middle of the night, a lot, my limbs would just go limp and I wouldn't be able to move them. That stopped. I mentioned this, but the joint soreness has stopped. I had really bad pressure headaches daily. A lot of it would be in my sinuses, around my eyes, behind my eyes, just in this front part where my hand is where I would experience a lot of facial pressure. I had pressure all over my head, but in my face, and that has gone away. It would get so bad to the point where I felt like my brain was it was just like coming out my ears. The pressure was intense, and that's gone away, as well as just like my head pain and headaches. I used to experience body pain in flares of symptoms. I'd have nerve pain running through my body, especially when I was sensory sensitive. I'd have pain in my head. That's gone away. I experienced a lot of numbness and tingling in my face. That's gone away. let me think, what else? Okay, pressure in my throat, that's gone away, but I mentioned that always happened coinciding with the difficulty breathing. Difficulty swallowing has gone away as well. Dry eyes. I had a lot of dry eyes, and that has improved. I would wake up and my eyes, like, it would be hard to open them because my eyes were so dry. So that's improved. I had frequent peeing, or I would frequently urinate. I thought that maybe I had tethered cord. That usually coincides with cervical instability, but interestingly enough, that improved with treating my neck. Nausea is much better. I would throw up. I haven't vomited since prolotherapy. Just like horrible nausea, especially in the morning, has gone away. I had really bad ringing ears every day, and just pain in my ears, sometimes fullness in my ears, that's gone away. I would be unsteady while I was walking, so basically how I describe it is my equilibrium felt off, which usually coincided with the dizziness and the dysautonomia, but that's gone away. I would be really klutzy. I'm not so klutzy anymore. Painful pins and needles in my arms, that's improved. Another thing that has improved is I had incontinence on occasion, which I thought also might be related to tethered cord, but it went away with treating my instability. My neck pain has gone away, especially at the base of my skull. I had a lot of pain there, and that's gone away. And with that, I would have radiating pain from my skull through my neck, which has gone away. I experienced a lot of post-exertional malaise, but in regards to cognition, so reading and writing and exerting myself mentally, not physically. Exercising always helped me, so I didn't experience post-exertional malaise from movement, but that has improved. It's not entirely gone. I still have a lowered level of my ability to mentally exert myself, but it's improved. Oh, so this is interesting. I had a really difficult time focusing my vision. So this goes along with the visual disturbances. I would look at something, and sometimes it would take me 15 seconds or more before my eyes could focus in on it. I would just have to stare at it for a while, whatever I was looking at, because it would just be blurry prior to my eyes focusing, but that's gone away. I had a lot of phlegm, so if you haven't noticed, right now I'm congested. I just have a cold, but prior to prolotherapy, I constantly had phlegm and was spitting up phlegm, and which can happen with instability. Basically, just your sinuses are infected, or not infected, are affected, and so I don't have as much phlegm anymore. It's improving. Going along with the peeing thing, the urination, because I would urinate sometimes up to like 5 times an hour. I would have like a burning sensation in my bladder, and that's gone away. I mentioned the dry eyes, just my whole body would feel more dry, and that's improved. So I would be exacerbated. My symptoms would all be exacerbated by jostling, car rides, plane rides. That doesn't impact me anymore. I can drive now, and I can do all of those things and experience nothing, which is amazing. I used to have pain radiating from my teeth into my jaw, and it was really intense. Also, just jaw pain. and that's gone away as well. So I'm sure there are a couple of other things as well, but those are most of the things that are either entirely gone or are improved since prolotherapy in treating my instability. And some of these things that aren't entirely gone, I'm hopeful that once my instability is completely gone, the associated symptoms will be gone as well, which is just incredible. So there's that. Oh, another thing I wanted to share, because I mentioned it in my last update video, I also have been diagnosed with Lyme disease. I have in my blood Bartonella and Borrelia burgdorferi. I am treating that currently, and I'm responding pretty well. And so I think some of the fatigue and less severe symptoms have, or less of my symptoms are associated with my Lyme disease that I'm currently treating. But I wanted to mention that because I know some people have instability and also have chronic Lyme disease, and I'm not sure if the two are related. I have heard some things about how potentially Lyme disease can weaken your ligaments, and so my Lyme disease may have made me more susceptible to cervical instability. It may have caused my cervical instability. I'm just not sure, but if you have cervical instability, it might also be worthwhile to look into getting tested for Lyme disease, especially if you don't have Ehlers-Danlos syndrome or connective tissue disorder. That's been helpful for me. And then the last thing that I wanted to say that's been helpful for me is I recently went on LDN. If you haven't heard of it before, it's low dose naltrexone, and that has helped with my sleep. So my sleep improved after prolotherapy drastically, but the LDNs helped me sleep deeper and helped with some of my symptoms while I'm treating my Lyme disease. So that is all for now. As always, I hope this was helpful, and yeah, that's basically it. Prolotherapy has changed my life and saved my quality of life, if not my very life itself. So if you have instability, I definitely think it is worth considering regenerative medicine and prolotherapy.